Hello, 405. Welcome to Lab 2, Monitoring Exercise Tests. For today's lab, the objectives are to learn how to conduct and monitor an exercise test, to record heart rate and blood pressure response to exercise. And the specific exercise test that we're going to do is called the two-stage Astrand-Rhyming cycle ergometer test. So the purposes of exercise testing, main purpose is to collect the baseline data and to know where the health or the level of fitness of your client. So this is also an opportunity for you to educate individuals about their current health and fitness status, relative, of course, to health-related standard and age and sex matched norms. Testing provides data that is helpful in developing the exercise prescription, XRX, meaning exercise prescription. And it's also a great opportunity to collect follow-up data for short and long-term progress evaluation, right? So you can do an exercise testing at the beginning of the exercise program, then maybe in the middle, then at the end of that exercise program, and measure the progress of your client in regards to their cardiovascular fitness or muscular fitness, for example. And also it helps in motivating individuals by establishing reasonable and attainable health and fitness goals. And exercise testing, we can measure their initial level of fitness, right? We can retest in the middle or at the end and create SMART goals. Like in this picture up here, where SMART stands for specific. What do I want to accomplish? M, measurable. How will I know when it is accomplished? A, of SMART, achievable. How can the goal be accomplished? R, realistic, most important one, right? Does this seem worthwhile and realistic to accomplish? And time bound, right? When can I accomplish this goal? Pre-test instructions for fitness testing. First and foremost is presenting all the pre-participation screening forms, right? That pre-activity health screening we performed. So you got to present the informed consent and allow the client to ask any questions if they have any, right? Make sure all screening forms and data recording forms are available prior to the test administration. Also, of course, perform the pre-participation screening and determine if there are any signs and symptoms of cardiovascular, metabolic, and renal disease, right? Performing the Part Q medical clearance, and then follow preliminary testing instructions. Make sure that all the equipment is calibrated and ready to go. And all of this will, if performed correctly, we can minimize test anxiety, and also that's for your client, right? But also, most importantly, it will allow you to be more than prepared for the exercise test and you will look professional. I attached a link here for a video that goes in a lot more depth on the pre-testing instructions for fitness testing. Now for exercise testing. Exercise tests are any tests using exercise to determine the patient's physiologic responses, physical condition, or both. And in lab this week, we'll be focusing on predictive tests. There are some maximal tests that are used to predict maximal capacity. For instance, a maximal VO2 test or a graded exercise test on the bike, where you're studying the heart rate and blood pressure response to exercise. Maximal exercise test refers to a standardized measure used to assess and evaluate the patient's functional capacity, like the Bruce protocol on on the treadmill, right? That VO2 max test to determine the VO2 max of your client, their aerobic functional capacity. And performance tests that involve measuring the responses to standardized physical activities that are typically encountered in everyday life. The performance tests can be anything from timing your 1 mile run or an 800-mile run, also 1 rep max test to measure lower body strength, like the squat, or the 1 rep max test of the bench press for upper body strength, and so on. Exercise testing, health-related physical fitness testing can be further split into two parts. A, fitness assessment testing. These are all classes of tests used to determine the physical fitness or condition of a client to assist in creating an exercise program. Like I said, the 1 rep max of the bench press, or max number of push-ups that you can do in a minute, right? Or max number of squats that you can do in a minute. All the different tests that we will be doing in lab, actually, for muscular fitness assessments. And also clinical exercise testing. These are classes of tests used to collect information for diagnosis and management of disease. And for instance, the graded exercise test, where we have our client working on a cycle ergometer, where our client has the EKG attached, and we can study the heart rate response to exercise, but also the electrical activity of the heart, right? And then we can study the heart rate response, heart rate function, and determine if there are any if there's a cardiovascular disease that we might want to be aware of. It could be used for the diagnosis, right, or the management of disease to test and measure the progress of the condition of our client with cardiovascular disease, for example. All right, let's talk about steady state heart rate response to exercise. So heart rate is observed to increase in a linear manner as the intensity of exercise increases. So let's look at our table over here to our right. This is the steady state response of our heart rate. Over here in our x-axis, we have percentage of VO2 max, and in our y-axis, we have heart rate, beats per minute. All right, so at rest, our heart rate's very low. Should make sense, right? And an average of 60 to 70 beats per minute. And as the intensity of exercise increases, remember that intensity can be a factor of percentage of VO2 max or percentage of heart rate max. That could be intensity. So as the intensity increases, our heart rate increases, right? That's your heart rate response with incremental changes in the intensity of the exercise. So while the heart rate begins to rise almost immediately after an increase in work rate, remember work rate is synonymous to the percentage of the intensity, percentage VO2 max, percentage of heart rate max. As the heart rate begins to rise almost immediately after an increase in the intensity, it takes a few minutes, 3 to 4 minutes is not uncommon, before the heart rate stabilizes to a new value called the steady state heart rate. And I'll show you in a second. At this point, the heart rate may still change just a little bit, right? Plus or minus 5 beats per minute, but on average does not continue to rise or fall, right? This is key right here. It remains steady at that work rate, and it does not continue to rise or fall. So it looks something like this. In our graph, you can see here on our right, In our x-axis, we have time in seconds, and in our y-axis, we have heart rate, beats per minute. So as you can see, our heart rate was at rest, and then when there was an increase in our workload or intensity, our heart rate begins to rise, but there's no other change in the workload, right? The workload or the intensity of that exercise increased from rest to when we increased the intensity, but didn't change anymore. It stayed the same. So our heart rate reaches a certain value. It looks like in our table here is between the 140 and 160 beats per minute, and it remains the same, right? There's a little bit of fluctuation here, which is very normal. Like in our previous slide, we said plus or minus 5 beats per minute. That's very normal at that specific workload. That heart rate fluctuates just a little bit, but remains steady at that workload, that intensity. So when the workload is constant, heart rate increases rapidly until it reaches that plateau, right? Steady state. And for each increase in workload or the intensity, heart rate will increase to a new steady state value within 2 and 3 minutes, right? It takes a little bit of time to reach that new steady state at that new intensity. But if workload is high, very, very high, then the heart rate may not plateau, but instead will slowly keep increasing. So what does that look like? It will look like something like this in our graph. This is your heart rate response to incremental changes in the work rate. So, for example, over here, again, in our x-axis, we have time in seconds, and then in our y, heart rate, beats per minute. So we begin over here, and at the beginning of the graded exercise test, for instance, our heart rate is at rest, and that incremental change in the work rate means intensity increased, heart rate will increase. So there's a change in the work rate that results in immediate changes to the heart rate. Right? It gets hard, then our heart rate goes up. Then there's another change in the work rate. So heart rate increases with that increase in the work rate. There's another change in the intensity, goes up, heart rate goes up. There's another change right here in the work rate, the heart rate goes up. And here you can see that at or near maximal work rate, heart rate will start to peak and not change anymore. And this is, we can see our plateau or the steady state heart rate. So this table, right? Simulating heart rate kinetics during incremental and interval training. So now let's shift and talk about the blood pressure response to exercise. So normally during dynamic rhythmic exercise, systolic blood pressure will increase proportionally with the work rate, while diastolic blood pressure may not significantly change or show a slight decrease. So what does that look like? Or here in our graph, to our right, we have that blood pressure response. Over here in our x-axis, we have percentage of VO2 max, and in our y, now we have blood pressure. So as you can see, for systolic blood pressure, let's look at that first. Systolic blood pressure is going to be your blue lines right here. And in this graph, it's depicting the arms and the legs systolic blood pressure. So for systolic blood pressure, you can see that it increases proportionally with an increase in the intensity, their work rate. And now looking at diastolic blood pressure for the arms and the legs, you can see that it does not significantly change. There's a very small increase And there might be a slight decrease as well, but compared to systolic, right, there's not a significant change. So this response occurs because of an increased cardiac output and decrease in total peripheral resistance. An increase in cardiac output, there's increase in systolic blood pressure, and decrease in total peripheral resistance. This diastolic blood pressure might not significantly change. This is because blood pressure is depending upon those two primary parameters, cardiac output and total peripheral resistance, where blood pressure, right, equals cardiac output times total peripheral resistance. Now let's talk a little bit about chronotropic incompetence. That's the inability of the heart to regulate its rate appropriately in response to physiologic stress or exercise. So this is very common in patients with cardiovascular disease, and it produces exercise intolerance, which impairs quality of life. And it's an independent predictor of major adverse cardiovascular events and overall mortality. So let's take a look at our graphs over here to our right. Graph A is a for x-axis, we have time, and heart rate we have on our y-axis. That remains the same for all of our graphs here. So in graph A, the first type is going to be a submaximal peak heart rate. So over here, our dotted line is the control. Client or individual that does not present chronotropic incompetence. And then our red line, solid line, is an individual with chronotropic incompetence. So we can see there might be a submaximal peak heart rate, right, as time went by, and when there was an increase in intensity on that exercise, heart rate goes up, and it reaches that heart rate value here. But for a client with chronotropic incompetence, it did not reach that peak heart rate. As you can see, it reached a different value. So that's one type, a submaximal peak heart rate. On graph B, we have a delayed heart rate response. So in our control, the individual, as time passed, there was an increase in the workload, heart rate increased, went up linearly with the increase in work rate. It reached that peak heart rate, and then when the exercise test or the workload was decreased, heart rate went down again. For individual with chronotropic incompetence, there's a delayed heart rate response, right? When there was an increase in the workload, heart rate didn't increase linearly, there was a delayed response. Over here, graph C, that is heart rate instability. Again, the control, linear increase in heart rate with increase in workload, and then similarly, decrease in workload, decrease in heart rate. For individual chronotropic incompetence, there's heart rate instability, right? Heart rate goes up and down, up and down. It's very unstable with that increase in the workload. And lastly, graph D, inadequate heart rate recovery. As time went by, again, our control increase, a linear increase in heart rate with increasing workload. Again, same for rest. And for our individual with chronotropic incompetence, there's a delayed heart rate recovery, right? Heart rate remained high, even with that decrease in the workload. This more in detail. Now, this is very important. We have to know the conditions to stop an exercise test. So number one is heart rate exceeds a predefined maximum, right? So there's an abnormal heart rate response to exercise. That's number one. If we do have and we're studying the heart rate response with an EKG, for instance, or a heart rate monitor, if there's an abnormal heart rate response, we need to stop the exercise test. Also, if we meet that predefined maximum. So for instance, if we are performing an exercise test and we establish that we want to stop that exercise test at 85% of that person's heart rate max, and when we're doing that test, the individual reaches that 85% of heart rate max, and we stop, right? And that's mainly because we didn't want our client to reach their maximal capacity. We wanted them to work at a sub-maximal capacity. This to avoid vigorous exercise, right, and keep heart rate below some safe threshold. Another condition could be an excessive perceived exertion. That's your RPE scale, and it should be consistent with the workload. So you might be familiar with the RPE scale. This is a summary of one that I just took from the internet. It can go from 7 to 11. This is very, very light exercise. 12 to 16, somewhat hard exercise, and 17 to 20, hard, very hard exercise. Now, this is perceived exertion, right? How you perceive the exercise and how difficult it might be. And that could be different to everyone, right? For novice exercises or compared to seasoned, very regular exercisers, this table is going to be very, very different, right? So it's very subjective. It's, perceived exertion. Take your precautions when you're using this RPE scale. You can also use this to set a pre-max RPE value, right? For instance, if they reach a 16, that when you are performing the exercise test and you ask them on a scale of 7 to 20 how hard they perceive the exercise to be, and they tell you it's a 16, hard exercise, and you establish that to be the stopping criteria, then you stop, right? And you can move on to the recovery period. Lastly, third one, abnormal blood pressure response. If you see that the blood pressure is, for instance, systolic blood pressure falls with increasing work rate, systolic blood pressure drops more than 10. So what was the normal systolic blood pressure response to exercise? Do you remember from previous slides? Systolic blood pressure increases with increasing increments in work rate, right? And if you see systolic blood pressure fall with increasing work rate, then that's not good, right? That's an abnormal response to blood pressure. So take a very close look to the systolic blood pressure. And overall, if you see an excessive rise in blood pressure, right? So if there's if systolic blood pressure is over 250 and diastolic blood pressure over 115, this is a very excessive rise. So if you see this as an abnormal blood pressure response, you should stop the test. Other reasons are if they present any signs and symptoms of exercise intolerance, like extreme fatigue, muscle cramps, nausea, if there's an abnormal ECG, if you're performing that, an unusual respiratory response, malfunctioning equipment, the subject cannot maintain the work rate, that they can't keep up with the intensity of the exercise, you stop the test, and also, most importantly, if the subject wants to stop. All right, so the in-lab practice, you are going to be performing the two-stage Astrand-Rhyming test. And before you start the test, we need to do a couple of calculations. Please take out your data sheet and fill out all the information here at the top, right? Subject, age, gender, height, weight, cardiovascular risk level that we determined from lab 1. And we're going to calculate maximum heart rate and fill out this table in lab. So you're going to have different stages. The time you're going to write down. There's going to be a specific cadence, resistance, work rate, and you're going to collect heart rate, blood pressure, and RPE. So first things first, we need to predict heart rate max. And you're going to calculate 85% of the heart rate max. So over here, this is table 5.3, ACSM 11th edition, the commonly used equations for estimating maximal heart rate. So you can use any of these. It's really up to you, but just select the appropriate population, right? You can use the Astrand equation for men and women aged 4 to 34 years old. For instance, I believe on 301, you learned about this one, I believe. Heart rate max equals 208 minus 0.7 times your age. This is for healthy men and women, right? So any of these equations are good. You're going to calculate your lab partner's heart rate max. And then from there, you're going to calculate 85% of that heart rate max. And this is the two-stage Astrand-Rhyming cycloergometer test. We're going to go over it in lab, but briefly, you're going to be selecting the appropriate column, right? So there's one for women, one for men, and if you're conditioned or unconditioned. So for example, if my client is a woman and she is conditioned, right? She is a regular exerciser according to ACSM guidelines. They exercise minimum 3 days per week, right? 30 minutes per day, and they've been exercising for the last 3 months, right? Are conditioned, then we're gonna start the protocol over here. On rest, they're just sitting on the bike for 3 minutes, and you're measuring resting values of heart rate and blood pressure. Then you're gonna start your warm-up stage for 3 minutes at 50 RPMs. This is your cadence, right? How fast you're pedaling on the bike, 50 RPMs at 0.5 of the resistance. On the cycloergometers at the lab, we're using the Monarch bikes, and the resistance is in kilograms. Okay, so don't forget, it's 0.5 kilograms. You are recording heart rate and blood pressure. In stage 1, you move up. This is 6 minutes in duration at 50 RPMs. Now 1.5 for the resistance. For 6 minutes, then you move on to the next 6 minutes. Same cadence, 50 RPMs. Then you level up to 2 kilograms of the resistance. And once that's up, you move on to the recovery period. 3 minutes, that same pace, but now at 0 resistance. So record heart rate every 30 seconds during the exercise and recovery, and every minute during the rest and the warm-up. But for blood pressure and RPE, you're going to record this every 3rd minute during all stages. It's going to be a little bit hard, and that's okay. We're going to get a lot of practice measuring blood pressure during exercise, and that's why I'm not having you do it every minute. You're going to be measuring blood pressure every 3rd minute. And lastly, most important thing is calculating the work rate. On your data sheet, you have this column right here where you have to calculate the work rate, and the work rate is going to be different, right, between stages. So in the warm-up, it's going to be different work rate, stage 1, stage 2, and the recovery, right? That's because of the resistance, how much resistance you put on the bike. So you have work rate equals the cadence, that's RPMs, that's going to be 50 RPMs, times the resistance. So it depends, right, on the stage. Warm up is 1, stage 1 is another 1, stage 2 is another 1, recovery it's another 1, times 6. 6 is going to be our constant for calculating work rate. So for example, stage 1, staying with my same example, my woman, a client as a woman is conditioned. Stage 1, 50 RPMs times the resistance 1.5 times 6. That will give me the work rate for that stage. And you're going to calculate that for all the stages. All right, team, that's it. The graph I'm going to explain in lab, and it's pretty much just plugging and chugging the data that you collected on your data sheets. You're going to be able to input that data into your graphs. For lab manual, just answer the discussion questions and submit the Excel graph on Canvas. Thank you, 405. Happy studying.